Angiogram is actually with coronary angiography. We call it as a coronary angiography, in which we inject the dye into the blood vessels of the heart and take the pictures. And we analyze it whether there is a block or normal vessel. If there is a block, then we have to treat it by opening, redilating with the balloon, and then stenting. We call it as angioplasty. Angiography is a kind of investigations where we check the vessels, coronary vessels, and its condition and its blockage. And in angioplasty, we treat the blockage. So angioplasty is a treatment. There are lots of indications for angiography. The most commonly we do it for STEMI. We call it as MI or heart attack, non-STEMI, unstable angina, or any chronic coronary syndrome patient who is not responding to maximum anti-anginal dose, and any patients who is going for valve replacement in CVTS, or for prior to that operations, we need angiography. Yes, we first confirm the diagnosis of the patient, and then we prepare the patient, take into the cath labs. We use the local anesthetics. We puncture at we have two access site, femoral and radial. Radial is commonly preferred because it is less painful and convenient and less complication. And we prick the radial artery, and we advance the catheters, and by we engage and hook the coronary ostium. There are two main coronary ostium, left and right, LCO and RCO, and we inject the dye through that catheters, and we visualize the vessels. This is how the angiography we do. As just we have seen that once we perform the angiography, then we analyze the reports, whether the vessels are normal or there is any blockage, or what is the condition of the vessel, is there is associated with the thrombus or calcifications, and we grade it according to type A, B, C lesion, and lots of scores are there to whether to treat or not to treat it. There is blockage. Normally 70% blockage, we consider it as a critical stenosis, and we plan to stent it. Before stenting, we pass the wire, workhorse wire, then we dilate it with the balloon, which called as pre-dilatation of the lesion, in which we try to open the lumen, which is occluded by the blockage, and then we deploy the stent to prevent the collapse, reversible coiling of the vessels. So this is how we do angioplasty. First we pass the wire, then pre-dilatations with the balloon, and then deployment of the stent into the vessels to restore the normal blood flow. Angioplasty is done to remove the blockage of the vessels which are obstructing and occluding the blood vessels and jeopardizing the blood supply of the myocardial tissue. Angioplasty, it depends upon the severity of the lesion. If the simple lesion, it takes hardly 30 minutes to 1 hour. If the angioplasty is complex, or it takes 2 to 3 hours. It is not actually painful. It is done to relieve pain or chest pain also. So we do it under the local anesthesia. Therefore, there is minimal or almost no pain at the puncture site, that is around the wrist. And during the angioplasty, while inflating the balloon and deploying the stent, some patient, very few patient, sometimes feel the chest pains, which will be relieved immediately after the stent deployment. So almost it is painless procedure, and it is intended to do and relieve the patient from the chest pain. Yes, we observe the patients in the ICU. Monitors are being observed continuously. We check patients' echo, and we are very vigilant to check the puncture site and the echo and the patient's vitals and patient's overall conditions first 24 hours after the angioplasty. Then we prescribe the medications, and patient have to take that medications regularly and follow the instructions given by the cardiologist strictly. Those are the important things to be done after the angioplasty. Angioplasty is a life-saving procedure, and it is done to treat the patients of heart attack. If you don't treat, the patient may land into the cardiac arrest, and which is life-threatening. So there are very least or almost no chances of any organ damage. Actually, we are protecting the heart, the most important organ of the body. but sometimes complications may occur, and but these incidents are very rare and less. Yes, we while doing the angioplasty, we dilate the blockage with the balloon, and then we deploy the stents, and it almost removes the blockage. But the care is to be taken by the patient not to redevelop that blockage, because those sites are very prone for redeveloping the blockage. If you don't take proper care as advised by the cardiologist, then in next 3 months or 1 year, there are high chances that the patient will present with again blockage. Actually, open heart surgery and bypass are almost synonymous. Open heart surgery includes many other procedures also, structural repairs like ICR and valve replacements and CABG, that is coronary artery bypass grafting. The CABG is almost equivalent to the angioplasty. CABG is open heart surgery done by CVTS surgeons where they bypass the blockage, they re-anastomose the new vessel which is harvested by the elsewhere from the body, and the anastomosis with the heart vessels. It means they almost replace the old vessel with the new one. That is bypass. It needs CVTS surgeon and OT and 1 week of hospitalization. For angioplasty, it is done in cath lab where there is no need of opening the chest and heart, and it is done in with the help of catheters, and patient can be discharged in 1 or 2 days. So it is minimally invasive, almost no non-invasive procedure, while the bypass is invasive procedures, and it takes sutures and healing, and hospital stay is more lengthy than angioplasty. But the ultimate aim of the both the procedure is same, that is restoring the blood flow to the heart and removing the blockage.